Today we're going to talk about the benefits of inversion therapy. Would you believe that for over 2,000 years, the medical community has been ignoring a time-tested and proven treatment for back pain? As you've likely experienced, most doctors are too busy treating the symptoms of back pain with treatments like anti-inflammatory medications, electrical stimulation, ultrasound, and cortisone injections, and they simply ignore what is one of the biggest factors that contributes to back pain. One of the biggest contributing factors to back pain is spinal compression. So what is spinal compression and how can it cause back pain? From the moment we're born, our bodies are at the mercy of gravity, a force that continuously creates pressure and stress on all of our muscles, bones, joints, and ligaments. By far, the part of the body that is affected most by gravity is the spine. The combination of gravity and muscle imbalances shove the vertebrae together, pressing on the discs. The inner core of your discs consists of jelly-like material that acts like a shock absorber system, providing flexibility and cushioning when you're sitting, standing, or exercising. During your normal daily activities, gravity causes fluid to squeeze out of your discs into adjacent soft tissue. With less space between the discs, you can lose some height. When you sleep, some but not all of the fluid soaks back into your discs. During a typical day, you can lose as much as 3/4 inch in height, and because there's only a partial recovery at night, the average person loses 1/2 inch to 2 inches in height by their senior years. Insufficient distance between the vertebrae can result in nerve root pressure, which in turn causes pain. To make matters worse, very often the pressure on the discs is not distributed evenly. Your discs were not designed to cope with such uneven pressure, and sooner or later it will be too much for them to withstand. The discs will bulge or herniate, causing spinal damage and likely a life with chronic pain. Even the slightest increase in spacing can be enough to allow a herniated disc to pop back into place or relieve pressure from a compressed nerve. Inversion therapy is a method of treating back pain by diminishing the influence of gravity, reducing the compression of the vertebrae and discs, and allowing the muscles and ligaments that encase the spine to relax. It is typically performed on what's called an inversion table. The table allows you to lie on your back relaxed in an inverted position. This position eliminates some or all gravitational compression, depending on how far back you position your body. Inversion therapy is the safest, quickest, and most effective way to increase the space between your vertebrae. Numerous clinical studies published in reputable medical journals have confirmed that inversion really does increase the separation between the discs of the spine, which brings relief from back pain. While inversion therapy is an excellent treatment for back pain, we should also mention other benefits people experience with a regular inversion program. These benefits are maintaining your height, improving circulation, relieves stress, heightens mental alertness, increased flexibility and range of motion, improvement in posture, and it also realigns the spine after workouts. If you're watching this video on YouTube, please visit our website www.losethebackpain.com. If you're watching this video on our website, please click on the links below to learn more about inversion therapy.